Did you know that something as common as swollen feet could be a red flag for liver issues? Or that the color of your skin and even the smell of your feet might be sending urgent signals about your liver's condition? In this video, we'll delve into the 25 ways your feet could be telling you your liver is in trouble. Number 1. Swollen feet. Have you ever noticed your feet swelling up like balloons? Swollen feet can be a sign of fluid retention, often due to liver failure. Fluid builds up because of poor circulation and low blood protein levels. This swelling, known as edema, can be uncomfortable and make your shoes feel tight. It can also indicate more serious issues like ascites, where fluid accumulates in the abdominal cavity. Swollen feet may also lead to skin stretching and an increased risk of infections. Number 2. Yellowing of the skin, jaundice. Yellow discoloration of the skin and whites of the eyes, known as jaundice, occurs when the liver cannot filter bilirubin from the blood effectively. This yellowing can extend to the feet, giving them a distinctive hue. Jaundice is often accompanied by other symptoms like dark urine and pale stools. The yellow tint is due to bilirubin, a byproduct of red blood cells breaking down and accumulating in your body when the liver isn't functioning properly. Jaundice can also cause itching and discomfort, making it a significant indicator of liver trouble. Number 3. Bruising easily. Liver disease can lead to reduced production of clotting factors, making the skin more prone to bruising, including on the feet. Even minor bumps or pressure can cause noticeable bruises. These bruises might be larger or take longer to fade than usual. Easy bruising can also be a sign of other liver-related issues, such as vitamin deficiencies or compromised blood health. Before we proceed to the next surprising way, be sure to hit the subscribe button. Number 4. Pain or tenderness. Have you ever experienced unexplained pain or tenderness in your feet? Pain in the feet could be due to inflammation or fluid buildup. This discomfort might be a sign of advanced liver disease or portal hypertension. The pain can range from mild to severe and might be localized or spread across the foot. Tenderness can make walking or standing painful, affecting your daily activities and mobility. Number 5. Pale or cold feet. Do your feet often feel cold or look pale? Poor circulation can cause feet to appear pale and feel cold. Reduced liver function affects blood flow and temperature regulation, leading to these symptoms. Cold feet can be uncomfortable and might make it difficult to warm up even in warm environments. Pale skin on your feet can also indicate anemia, a common complication of liver disease. Number 6. Changes in nail appearance. Nails may become brittle, develop ridges, or change color, yellowing or darkening due to liver disease. These changes can indicate nutrient absorption issues which affect nail health. Brittle nails can break easily, while ridges might give your nails a rough texture. Discoloration can range from a slight yellow tint to dark streaks, signaling underlying health issues. Feeling itchy? Up next, we'll delve into why your feet might be itching and what it could mean for your liver. Number 7. Itchy feet. Itching can occur due to bile acid buildup when the liver is not functioning properly. This itchiness can be intense and persistent, even without any visible skin changes. Scratching can lead to secondary skin infections or damage, adding to the discomfort. The itching might be worse at night or after activities that increase your body temperature. Number 8. Fatigue and weakness. Do you feel like your feet are constantly tired and weak? Liver disease can cause overall fatigue, affecting the feet in particular. Reduced energy levels and muscle weakness are common, making it harder to stay active. You might find that your feet feel heavy or tired even after minimal exertion. This fatigue can also make it difficult to engage in activities you once enjoyed, leading to a more sedentary lifestyle. Number 9. Foot odor changes. Changes in body odor, including the feet, can occur due to liver dysfunction. Liver failure can lead to a distinctive odor as the body tries to eliminate toxins through the skin. This odor can be strong and unpleasant, often described as musty or sweet. You might notice that your usual hygiene routine isn't as effective in controlling foot odor. Number 10. Foot cramps. Electrolyte imbalances, common in liver disease, can cause muscle cramps. Often felt in the feet, especially at night, these cramps can be painful and disruptive. The imbalance of minerals like potassium, calcium, and magnesium can lead to sudden intense muscle contractions. These cramps can wake you up from sleep and leave your muscles feeling sore and stiff. Number 11. Swollen ankles. Swelling around the ankles can be a sign of liver disease. Fluid accumulates when the liver cannot process proteins and fluids effectively. This swelling, known as edema, can make your ankles feel tight and heavy. It might be accompanied by a feeling of pressure or discomfort, especially after standing or walking for long periods. Number 12. Foot or toe deformities. Have you noticed any deformities in your feet or toes? Liver disease can contribute to deformities due to vitamin deficiencies. Malnutrition, a common effect of liver disease, can weaken bones and affect foot structure. You might notice changes in the shape of your toes or the arches of your feet. These deformities can cause discomfort and make it difficult to find comfortable footwear. Number 13. Increased sweating. Liver problems can affect the body's temperature regulatory mechanisms, resulting in excessive sweating, particularly in the feet. This can lead to discomfort and make it hard to keep your feet dry. Excessive sweating can also create a breeding ground for bacteria and fungi, leading to infections and unpleasant odors. You might notice your feet sweating more than usual, even without physical activity. Number 14. Foot skin color changes. Have you noticed changes in the color of your feet? Liver disease can lead to skin discoloration, including on the feet. This may range from darkening, hyperpigmentation, to a yellow hue, jaundice. These changes in skin color can be alarming and are often accompanied by other symptoms like itching or discomfort. Hyperpigmentation can cause patches of dark skin, while jaundice results from the buildup of bilirubin in the blood. Number 15. Foot vein issues. Varicose veins or other vein problems can arise due to poor circulation caused by liver issues. These conditions can be exacerbated by fluid retention and pressure in the legs. You might notice veins that are enlarged, twisted, or painful. These vein issues can lead to a feeling of heaviness or aching in the legs and feet, impacting your mobility and comfort. Over time, these vein problems can worsen, leading to more pronounced symptoms and increased discomfort. You might also experience skin changes around the veins, such as discoloration or the development of ulcers. Number 16. Foot swelling with redness. Is the swelling in your feet accompanied by redness? Redness along with swelling can be a sign of inflammation or infection. In patients with liver disease, this can indicate a more severe condition. The combination of swelling and redness often points to an underlying issue that needs attention. This inflammation can be painful and may restrict your range of motion, making it difficult to walk or stand for long periods. You might also notice that the redness is warm to the touch, indicating active inflammation. This symptom can escalate quickly, so it's important to pay attention to any accompanying pain or discomfort. Number 17. Foot pain during night. Nocturnal foot pain can be a symptom of liver dysfunction. Poor blood flow and metabolic changes at night may exacerbate this pain. You might find it difficult to get comfortable, leading to restless nights. This pain can vary from a dull ache to sharp stabbing sensations, disrupting your sleep and leaving you feeling fatigued during the day. Persistent night pain can also lead to anxiety about sleeping, further impacting your overall health. The lack of restful sleep can compound other symptoms, making it harder to cope with daily activities. Number 18. Decreased foot sensitivity. Reduced sensation in the feet, known as peripheral neuropathy, can be a warning sign of liver disease. This condition often results from chronic liver problems that affect nerve health. You might experience numbness, tingling, or a burning sensation in your feet. Peripheral neuropathy can also affect your balance, making it easier to trip or fall. This reduced sensitivity can make it difficult to detect injuries or changes in temperature, increasing the risk of unnoticed harm. Over time, nerve damage can lead to more severe complications, such as difficulty walking or performing daily tasks. Number 19. Persistent foot infections. Do you find yourself battling foot infections that just won't go away? Compromised liver function can weaken the immune system, making you more susceptible to infections, especially in areas with poor circulation like the feet. Persistent infections can be difficult to treat and may recur frequently. These infections might include fungal issues, bacterial infections, or slow-healing wounds that don't respond well to typical treatments. Chronic infections can lead to further complications, such as cellulitis or abscesses, which require more intensive medical intervention. Number 20. Foot bleeding or bruising. Liver issues affect blood clotting mechanisms, leading to easy bruising or bleeding from minor injuries on the feet. You might notice that small cuts take longer to heal, or that you bruise more easily than before. This happens because the liver produces proteins essential for blood clotting. Without these proteins, your body struggles to repair even minor damage, leading to prolonged bleeding and visible bruises. These symptoms can make you more cautious about activities that might result in injury. Over time, frequent bruising and slow healing can lead to more significant health concerns, such as chronic wounds or infections. Number 21. Alterations in foot gait or walking patterns. Weakness or pain caused by liver disease can affect your gait. You might notice limping or favoring one foot over the other. These changes can lead to additional strain on your muscles and joints, causing further discomfort. Over time, altered walking patterns can lead to long-term musculoskeletal issues, making it harder to move comfortably. These gait changes can also impact your posture, leading to back or hip pain. The cumulative effect of these issues can reduce your overall mobility and independence, making it crucial to address any walking difficulties early on. Number 22. Increased foot sweating at night. Night sweats, particularly in the feet, can be a symptom of liver disease. Excessive sweating can lead to discomfort and increase the risk of fungal infections like athlete's foot. It might also disrupt your sleep, affecting your overall well-being. Sweating is one of the body's ways to eliminate toxins, and an overworked liver might trigger this response more frequently. This increased moisture can also lead to skin issues, such as rashes or sores. Number 23. Foot and toe numbness. Numbness in the feet and toes can be a result of nerve damage or neuropathy, often associated with liver disease. This numbness can make it difficult to feel injuries or changes in temperature, increasing the risk of unnoticed harm. Nerve damage can also lead to a tingling or burning sensation, making everyday tasks uncomfortable. This sensory loss is often gradual, creeping up slowly until it becomes noticeable. Number 24. Foot tissue changes. Do you have sores on your feet that don't seem to heal? Ulcers or sores on your feet that don't heal could be a sign of liver-related circulatory issues. Poor liver function affects blood flow and the body's ability to repair itself. These sores can be painful and prone to infection, leading to more serious complications. Chronic ulcers might also indicate underlying issues with blood clotting, another function regulated by the liver. The persistent nature of these wounds can make walking and other activities painful, reducing your quality of life. Number 25. Foot muscle wasting. If you notice your feet looking smaller or less muscular, this could be a sign of muscle wasting or muscle atrophy. Liver disease can lead to malnutrition, which affects muscle mass throughout the body, including your feet. Muscle wasting can make it difficult to stay active and perform daily activities, further impacting your overall health. This condition is often accompanied by a general loss of strength and vitality. The decreased muscle mass can also lead to more frequent injuries, as your feet are less able to support your weight and movement. Over time, muscle atrophy can significantly affect your mobility and independence, making it crucial to address any symptoms early. It is essential to seek medical attention if any of these symptoms are experienced. If you found this video helpful, please give it a thumbs up. Thank you for watching, and for more amazing videos, subscribe to our channel.